We are back, and joining us right now is Dr. Phil Bondurant from the Summit County Health Department, updating us on everything happening at the health department, especially in regards to COVID-19. Dr. Bondurant, thanks for joining us again.
Thank you for having me. Good morning.
So we are coming up on 3 months of talking with you, of trying to keep the spread of this virus at a minimum here in Summit County. How have priorities changed or remained the same from when it first began to where we are today?
The priorities of the health department remain the same, even in times of a pandemic, flu season, summer events. It's always about protecting community health and ensuring a safe and healthy environment for our residents, for our community, for our visitors. So the priorities remain the same. The topic is obviously much different this go around than it has been in past. In the initial stages of the COVID response, it was about understanding what it looks like in our community, understanding spread and the dynamics of the situation, and trying to get a handle on it as best as possible. Now that we've entered a phase where we have certain guidelines and restrictions that have been set forth by the governor, our idea now, or our primary focus, is more about understanding how the community is perceiving this, and then providing them with the tools and the education and the assets to make wise decisions about certain risks and the risk that they're willing to take, and keeping our community up to speed on the most recent developments regarding COVID. And then, of course, preparing for what is predicted to happen with the second wave during the fall, and making sure that we have the resources, the staff, and an understanding of how to deal with that, or give our best effort in dealing with that in the should that come about this fall.
You know, I feel like there's a general fatigue in talking about the pandemic, the virus, as things are starting to open more here in Park City, in Summit County in general. Kind of gives the perception that things are getting better. Now, from your perspective, how are the numbers here? Because they seem to be quite high in Utah.
Yeah, there's definitely a fatigue of the COVID response, the COVID pandemic across the board. Everyone from in the community all the way up to local government and public health. We are all ready to get back to normal and begin living our lives in a way that we've become accustomed to. However, that's from what we're seeing across the state. We're still not out of the woods yet. I just briefly spoke about a potential second wave. We're seeing things like this occur over in China again. Beijing has gone to lockdown again to curb their what's being deemed a second wave in that area of the world. And so we're trying to avoid that here as well. But when you look at Summit County and where we are, we're in good shape. We continue to see an average of 1 to 3 cases a day. We have very low transmission rates here, according to the info that we have, or the data that we have. But that's not the case around the rest of the state. When you look at some of our neighbors, some other counties in the state of Utah, there's still some activity, and some significant activity. When you look at headlines in there, we're upwards of 250 to 300 new cases per day. That's fairly significant for a new disease where there's no antibodies, where there's no resistance in the community, and there's no vaccine. And that's by no means exponential growth, but it is significant growth. So while we remain fortunate here, and our trends in Summit County are definitely favorable, we hope that trend continues as we get into some of our later summer events that may or may not be held, and then we look forward to ski season. I'm not sure that we're going to be able to avoid what's occurring in some of our neighboring counties. So right now we're good. The community is doing their part. We see a lot of masks out and about, people social distancing, and all of that is beneficial and has contributed to our low numbers. And we hope that despite the fatigue and the numbness around hearing about COVID, we hope that people can remain vigilant and diligent, and do those things to help us curb this spread and keep these numbers low.
You mentioned a potential second wave. Where are we right now? Are we still in the first wave? Does it even matter? Is this just a matter of semantics? How do you kind of define this place where we are right at this moment?
Yeah, right now, the state epidemiologist, Dr. Angela Dunn, has labeled this a resurgent phase, where we begin to remove restrictions and you see some cases increase, and we expected that as we began to roll back some of the prohibitions. So right now we're kind of in a not necessarily a holding pattern, but I don't believe, based on what I've seen and what I've been told, that we have entered into a second wave. Second wave is typically defined by the same growth in the state and in Summit County that we saw in March and April, where it's the number of new cases are exceeding the number of people recovered and those that are recovering, and we have not seen that yet here in Summit County. And the state is kind of we're seeing growth, but it's not growth like we saw early on in the pandemic. So we're hopeful that this begins to level off, but based on what we're seeing with the resurgence and the second go of this in China and other areas of the world, that we're hopeful that we're able to avoid that, but it's not it's not very promising that we're going to be able to avoid that.
And how are our healthcare facilities doing here in Summit County? Is our hospital seeing increased numbers? Do they seem to be doing okay? Are more people getting tested? I know last week you also mentioned that more tests, I believe, are coming back positive. Kind of where are we at right now in comparison to last week, and are we doing okay within the testing in our healthcare facilities here?
Yeah, testing still remains low in Summit County. The best way to understand how a pandemic is affecting or impacting a community is through testing and testing deep into the community. Our local healthcare providers, Park City Hospital, have been absolutely phenomenal. They continue to work closely with us. They are an extremely important partner in this, and they continue to manage the care aspect of the COVID response at a very high level. They have not reached a point where they have been at capacity. In fact, my understanding is that some of the ICU beds that they have up there have been used by some of the more seasonal injuries that we typically see associated with mountain biking or some of these outdoor activities. More of a regular pattern in IC bed use. So our local system, which has been the goal from the beginning, is to not overwhelm the system and then, of course, limit the spread. Our local system has fared fairly well through this, and the healthcare professionals and medical professionals up there at our hospital have done a great job, and we're fortunate. When we look at the testing has number of positive cases remains consistent. We're still seeing around that 5%. Last week it was a little bit higher, but we dropped down to about a 5% positive rate, which is consistent with the rest of the nation. But we're not seeing a high number of tests come through. We're seeing a drop off in the number of tests. So when you look at that fewer tests but a consistent positivity rate, that means that individuals that are sick are being tested, but we're not seeing a lot of individuals tested beyond that. And that's an effort to control and reserve some of those tests. So it's kind of a double-edged sword when you look at it that way. But we definitely still encourage people, if you have any one of the symptoms, if you've been exposed to anybody that has been a COVID positive, please seek out a test through one of the approved providers that tend to still up and running up here at the hospital. It's a drive-up testing clinic. It's very efficient, very quick. The professionals up there are very good at what they do, and we encourage people to take advantage of that.
You mentioned wearing masks. Where can we get more information and find everything we need to know here in Summit County, especially as we venture out more, we see more visitors here within our local area? Where's the best place to go for all that information?
For the most recent and updated information specific to Summit County, always the summitcountyhealth.org website. That's our local website where we pull information from all of the national and state level data providers. You can head to the Utah Department of Health website as well. And of course, we always encourage people to seek out resources from the CDC and World Health Organization as they do their own research about what this means for them and their families. We try to do our best to consolidate that on our website and encourage people to visit there as they're doing their research.
Well, thank you so much, Dr. Phil Bondurant, for joining us today. We always appreciate you taking the time to inform our viewers. Always great information. So thanks again to Dr. Bondurant and all of the Summit County Health Department staff for helping keep us safe and reduce spread during this pandemic. We'll be back with more right after this.